Hey everybody, this is Crystal Garvin, and I am so sorry for the technical difficulties we were having due to my computer not cooperating tonight after we tested everything out earlier today and thought it was all working. So I hope you're all doing well this evening. Thank you for your patience. We are going to get started. I am here with Diane Carroll. You can't see her, but I wanted to just introduce myself and say hello and tell you I'm really sorry for the delay. This shouldn't be a normal thing, so in the future, hopefully that won't happen again, but you know how technical difficulties can be. So I'm going to switch over to Diane's presentation. And Diane, if you would like, you can go ahead and just introduce yourself and give some background on yourself. That would be great.
Okay. Thank you, Crystal, and thank you for giving me this opportunity to present this evening. I remember, gosh, I think it's been a couple of years now when we first talked about this, and I thought it might be fun to do a presentation on the inflammatory response. My mom suffers from an autoimmune disorder, rheumatoid arthritis, to be exact, and she acquired that when I was 6 months old, so she's been living with it most of her life, and I grew up with experiencing her and having some issues and pain issues and just some debilitating effects with that. And so it's kind of a topic that's near and dear to my heart. And I was really excited when I was introduced to essential oils a couple of years ago. Well, it's been almost 3 years now that I've been using them. And since then, we've really been able to find some good helps for my mom. She's taking a Lifelong Vitality pack now, and she's using a lot of the deep blue products and marjoram and white fir, and so she's getting a lot of support. So I'm really excited about that. So like I said, I've been a wellness advocate for 3 years, and I've been sharing with others for almost as long. And so that's basically how I got started.
Well, and we're really excited to have you as one of our newest silvers as well. So some of you who are customers may not realize what that means, but Diane advanced to leadership rank with Doterra just a few days ago, and it was very exciting. And she's been a leader for a long time, which is usually the case. You start leading well before you get to what's considered a leadership rank, but we're really excited and happy for her and proud of her. And Diane, too, if you wouldn't mind sharing a little bit about your professional background as well. I know that will interest some people.
Oh, sure. Thank you. Yeah, I am excited to be part of the leadership. I guess legally now, you could say. Officially, I don't know. But yeah, that was super exciting. And of course, that's all, just by the grace of God and the wonderful team that I have, both downline and upline. So yeah, my background is in oncology nursing. I've been a registered nurse for over 18 years, and I worked the first few years in the bone marrow transplant population, and then the rest of my time has been with solid tumor and some heme malignancies as well. So mostly chemotherapy, infusion, and that sort of thing. But I stepped away about a year ago for several reasons, and it just was the Lord's direction, and He's just really blessed me in this business and giving me the opportunity to share natural solutions with others. And it's just been really exciting and very rewarding. So,
awesome. Well, I will let you go ahead and jump right in, and I'll be running the slides here. So if I'm slow on the uptake, you just let me know when you're ready for me to go to the next one.
Okay. All right. Thank you, Crystal. All right. So tonight I'm just going to be going over the inflammatory response and how we can use essential oils to help support the pain and discomfort that's often associated with it. And I subtitled it, What, So What, Now What? Because I wanted to approach it in a way that is similar to the way that I was taught to assess a patient in nursing school. And the what is basically your subjective and objective data. What is this patient complaining about? What are his or her vital signs, lab values, medical history? And the so what then is your analysis of that documented information. Why is this information pertinent? What might be going on? And then now what is your plan of care for this patient? What are you going to do about it? And so first of all, we will look at what the inflammatory response is, and then we will consider why the inflammatory response is important, and also how it can become a system that is dysregulated or out of balance. And lastly, we will look at how we can support the inflammatory response, as I mentioned earlier. Now, the what and the so what will be discussed from my experience, education, and research as a nurse, while the now what will be taught from my research, education, and experience as a Doterra wellness advocate. So there's a lot of information on these slides, and some of it's going to seem really technical. Don't feel like you have to write everything down. If you can, take a screenshot. That might be the easiest thing to do, because I do want to try and get through it in a reasonable amount of time. So what is the inflammatory response? Well, the definition basically is any response to a tissue injury, such as trauma, chemicals, or an antigen. And it's a natural defense mechanism, and it's also a protective response. It also is an immune-activated response, so it stems from our immune system. And inflammation is typically confined to a specific area. We call that localized. At times it can be systemic, but typically it's confined to one area. And the purpose then of the inflammatory response is to both eliminate the initial cause and also to eliminate the dead cells and tissues that resulted from the original insult. All right, so what might you see or feel? I found this little acronym, PRISH. It stands for pain, redness, immobility or loss of function, swelling, and heat. Now, the redness and the heat are due to increased blood flow to the site of the injury. The swelling is due to the accumulation of fluid as a result of the increased blood flow. And the swelling then comprises the nerve endings near the injury, causing pain. And while none of these are particularly comfortable, and they're often can be miserable actually for a time, these symptoms are necessary as a means of making us aware that there's an injury. Without the inflammatory response, our cells and tissues would be destroyed and simply die off. Go ahead. All right. So we do need to look at the inflammatory response as a good thing. This slide looks at the inflammatory response more on a cellular level. Each of these cells has a direct role in the immune response, both with the secretion of various hormones and cytokines. I do want you to pay special attention to the cytokines, as they play a huge role in the inflammatory response. They're a small protein that activate other cells, and they regulate the nature, intensity, and duration of the immune response. And they can be either pro-inflammatory or anti-inflammatory. So you see here a picture of a wound, perhaps, where the tissue's been injured. Blood platelets are released there to help with clotting. And then you have the mast cells, those green cells. Those are the master regulators. They're going to send signals to the vasculature to increase the delivery of that blood and plasma and other cells to the injured area. And that's when you see your swelling and redness and heat and so forth. Now the macrophages, those purple guys on the bottom, those are your cytokines. They're known as molecular messengers. And they're going to signal other immune system cells to the site and activate the rest of the cells that are involved in the actual tissue repair. One of those would be your neutrophils, and those are the blue guys there that you see in the slide. Now the neutrophils are a specific type of white blood cell, and they're actually the first line of defense against infection. If you don't have any neutrophils, and you don't have a plan as to how you're going to get some, you will eventually die from infection. And occasionally we would see that in our bone marrow transplant patients. We would completely ablate their bone marrow, wipe out their white blood cell line, and their neutrophils would be down to 0. And we would have to wait. Of course, we would give them some bone marrow back or stem cells. And there would be a waiting period for those cells to then engraft, those new cells to engraft in their marrow bed. But it was tricky. I mean, occasionally there were times where they wouldn't engraft, and then there's a real problem. Those people don't have an immune system, and a lot of times it's infection that causes them to pass, not the cancer itself. So you definitely need your neutrophils, and these are the cells that are going to then secrete enzymes that will kill those pathogens, degrade them, break them down, and then remove them by a process called phagocytosis, and that's where they engulf them and eat them. So you can think of that as like the Pac-Man cells. The macrophages are the same way. They're the big eaters. They're going to remove those pathogens as well by phagocytosis, by engulfing and eating them. Right, so this is the basic inflammatory response, and this is going to continue until all of that foreign material has been removed, the tissue is repaired, and your body has achieved homeostasis. Okay, now, remember I said that the macrophages secrete cytokines. Now these cytokines are part of the inflammatory response, and they will travel throughout the entire bloodstream. They're going to go directly to the liver, and they're going to tell the liver to produce high levels of C-Reactive Protein, also known as CRP. Now the C-Reactive Protein is a pro-inflammatory marker, and it's fundamental in the inflammatory process. It's absolutely necessary for wound healing, fighting pathogens, etc. And it's also going to signal that fight or flight response. Go ahead. Right, so I think we're all familiar with the fight or flight response. It's the body's mechanism by which it attempts to protect itself from a perceived threat. So this response then is going to trigger cortisol, which we know is our stress hormone, right? It's released from the adrenals, and those are the little red hats you sit in there labeled A. And the cortisol not only is that stress response, but it has a major influence on your insulin levels as well as your metabolism. Okay, and it plays a huge role in what we know as chronic or long-term inflammation. And you can see here on this slide some of the things that happen in each of our systems when that fight or flight response is triggered, right? Our breathing quickens, our heart rate goes up, our blood pressure increases, everything in the gut slows down because we don't need anything. We don't need anything going on in our gut. We need it all in our major organs and our periphery. Might have chills, sweating, dry mouth, muscles become tense, that sort of thing. All right, so that's the inflammatory response, just kind of in a nutshell, very basic. Now that we know a little bit about what it is, we can ask ourselves, well, So what? Why does this matter? This is where the inflammatory response now becomes a two-edged sword. You can't live without inflammation, but it can also be hazardous to your health. You see, when the inflammatory response doesn't get turned off, it becomes what is known as chronic or systemic inflammation. So it's no longer a pro-healing response, but rather it becomes a symptom of something that has gone wrong, and it can last months or even years. All right, so let's define that long-term inflammation, or what we know as chronic inflammation. We know that chronic means it lasts for several months or even years. Causes of it can be a couple of different things. One is the body's inability to repair the initial cause of the inflammatory response in the first place, whether that's infection or trauma. The second thing would be an autoimmune response, and that's when your body mistakes healthy tissue as foreign and attacks it on an ongoing basis. We aren't sure exactly why this happens, but it does. And some examples of it are lupus, rheumatoid arthritis, Crohn's, and psoriasis. But there are other factors that can become what we call a chronic irritant of low intensity that persists. And these are the factors, it's these other factors really that I want to go over with you a little bit. And I've found various studies that go along with each of the factors. For the sake of time, I won't discuss all of them. But if you could go ahead to the next slide. Thank you. Okay, so this is poor Homer. When I saw this picture, I thought he really looked like the classic textbook definition of somebody who's has chronic inflammation and maybe has several of these factors playing a role in that. Smoking is kind of a no-brainer. We know that that's inflammatory to our respiratory system, our cardiovascular system. Lack of exercise. There was actually a study done, over 75 studies done at Western Washington University. And there was one specifically that showed a link between sedentary lifestyle and the development of low-grade inflammation. Now, conversely, when our skeletal muscles perform work, when we are exercising, they actually release anti-inflammatory substances into the bloodstream. So exercise would be a good thing. And then poor sleep quality. There was a study at Emory University that concluded that poor sleep quality and short sleep duration was associated with higher levels of inflammation. And then we have our saturated fats and our trans fats, right? Saturated fats are your high fat or high calorie meals. Your trans fats are going to be those things that are highly processed or refined. Harvard Health Publications had an article explaining how these fats that are found in food items such as salad dressing, mayonnaise, certain cooking oils, they actually trigger the body to release pro-inflammatory chemicals. In your refined foods, those things that are sugar-laden and white, they increase the level of cytokines due to a blood sugar bolus. And remember what we said earlier about cytokines. They're the ones that go to the liver and tell the liver to secrete that C-Reactive Protein, which is a pro-inflammatory marker. So your increased consumption of these refined foods is going to increase those levels of cytokines. And this is because of the blood sugar bolus, okay? And I did learn at one of Doterra's educational summits that the #1 abused substance in our country is sugar. So a better option would be whole grains, brown rice. Those items are going to actually temper that rise in blood sugar and insulin, and thus, dampen that cytokine production. Okay, and there's also some research out there that has shown that MSG can trigger pathways responsible for chronic inflammation. Gluten, as we know, can cause inflammation in the intestines. What happens is the inflammatory cells in our intestines are going to see that gluten protein as foreign and attack it, and then that's going to trigger that inflammatory response. So you don't have to have a celiac diagnosis to be sensitive to gluten, and that's really the reason why your body just doesn't recognize it. Casein is similar. That's the protein that you find in your dairy products. That protein actually requires specific enzymes to break it down. And if that enzyme is either missing or malfunctioning, the remaining portion of that protein then is seen as foreign by our immune system, and again, it's going to trigger that autoimmune response. And then our omega-6 fatty acids. Omega-6s are the third highest inflammatory food group. Okay, and these are your vegetable oils, soybean oil, peanut oil, safflower, sunflower. They trigger the inflammatory response specifically in the cardiovascular system. And now we do need these omega-6s in our diet, but what we need is for them to be balanced with our omega-3s. And the problem is with our typical American diet that many of us eat 25 times more omega-6s than omega-3s. So you can see the imbalance here, and that's the imbalance that causes that high inflammation. And then aspartame is a known neurotoxin. Neuro is brain, toxin is poison, so if you put those together, you have essentially brain poison. But I don't think we need to say any more about that. And again, the body, of course, is going to see that as foreign and trigger that inflammatory response. And lastly, alcohol. In addition to burdening the liver and weakening its function, it actually disrupts the function of many of our organs, which then can lead to inflammation. Of course, we can't forget about stress. I will say that there are times when I have felt completely overwhelmed, burdened, if you will. When I saw the picture of this elephant on this man's back, you feel like you're carrying the weight of the world on your shoulders sometimes. Maybe you have a to-do list that's just far beyond your capacity to take care of, and or maybe you just have a lot of responsibilities and a lot of balls in the air that you're trying to juggle. But when we let's see, could I see the next slide, Kristen? So remember, when we have that kind of stress, the body's going to see that as a threat, and it's going to trigger that fight or flight response. And so the cytokines are going to be released. The C-reactive protein is going to be doing its job to try and protect us with that fight or flight response. It's necessary. However, these same chemicals are supposed to shut off when that threat is no longer perceived, right? But what happens when that threat continues to be present in the form of stress? You see, under that kind of stress, those proteins are continually being released. That mechanism is not getting shut off. And so then you end up wreaking havoc on all of your tissues and organ systems. All right, so let's talk a little bit more about that C-reactive protein. And there's a couple of proteins here I want to talk about just a little bit so that you have some understanding of how they work in the inflammatory response and some of the things that they're responsible for. And that's because later on when we look at the essential oils and the things that we can do to help balance our inflammatory response, these proteins are going to come into play. So C-reactive protein then is, like we said, a key inflammatory marker when we're assessing disease processes. So if you think that you may have high levels of inflammation, if you're in, if you go to see your physician and they're going to work you up, maybe for your risk of heart disease, they're going to draw CRP. And because there's a direct correlation between the elevated CRP levels and your risk of heart disease. Standard is if it's greater than 3 milligrams per liter, then your risk of heart attack is nearly doubled. And this marker is linked to heart attack, stroke, peripheral arterial disease, sudden cardiac death, and type 2 diabetes. And so the data out there clearly link inflammation, atherothrombosis, and diabetes as tightly interrelated disorders of the immune system. So when we think about how we're going to strengthen or boost our immune system, and we talk about oils like, On Guard and Clove and Arbor Vitae and things like that, and we talk about the Lifelong Vitality Pack. We're not making this stuff up. I mean, the data is out there, and these could potentially be serious issues. All right, so moving on to nuclear factor kappa B, another protein, NFKB for short. This happens to be the master regulator of our immune response. Okay, it regulates over 150 inflammatory genes. And it also happens to control that cytokine production that we talked about, as well as other pro-inflammatory enzymes. And it's involved in all of the cellular responses to stimuli such as stress, cytokines, free radicals, UV radiation, oxidized LDL, as well as your bacterial and viral antigens. And it also plays a key role in regulating the immune response to infection. So again, very necessary. But what happens when this NFKB is not regulated? If there's an incorrect regulation, if these systems are not turned off, if we're constantly bombarded with inflammation, well, then we have the potential for disease processes to ensue, and those could be cancer, any of your inflammatory or autoimmune diseases, septic shock, viral infection, as well as improper immune development. But now, this is all from the International Journal of Molecular Science. What they found is the inhibition of that NFKB complex actually reduces the inflammatory response. And that's the thing that I want you to remember, because we're going to look at some things later that are going to do just that, if you will, inhibit that pathway when it's out of balance. Okay. So how do I know if I'm experiencing some level of cellular inflammation? Well, ultimately, that would be something that you and your physician would need to work up and determine. But some of you know that you suffer from chronic inflammation, either by diagnosis of an illness or even a disease process, and it's obvious by how you feel. But for others, it may be a bit more subtle. And so these are some things that you might feel with no ready relief. You're always tired, depression, stomach pains, issues with skin and mucous membranes, joint pain, headaches. These are things that are otherwise unexplained. So maybe you've tried everything under the sun, nothing helps, your doctor's worked everything up. Maybe you just chalk it up to you're getting old. I don't know. But inflammation is something that you may want to consider if that's the case. So the bottom line is, and I read this in an article, and I believe that it really summarizes this information accurately, that our bodies simply are not designed to take on the accepted daily barrage of toxins, infectious agents, and stress. Our immune system's resilience can only go so far when trying to support this bombardment. And what we end up with is cellular stress and malfunction. But thankfully, we have Doterra. So this is where I'm going to change hats a little bit, and I'll be speaking more from a Doterra wellness advocate position. And I want to start by saying that after researching all of this, I am so thankful for Doterra's essential oils and the balance that they can bring to our bodies so that they can do what they were designed to do, which is regulate and heal themselves. And two, I just want to say that, you know, while I am a registered nurse, and it certainly comes in handy in terms of being familiar with terminology and bodily processes, I'm not an expert in this area. I simply did the research and I learned as I went along. And I'm just really excited to be able to share it with all of you because I have a lot of years of experience, you know, like I said, treating the oncology population, where pain and inflammation was a significant problem. And I've seen the detriment that it can be on people's quality of life. And oftentimes the best I could do was teach them how to take their narcotics and manage the side effects and maybe a handful of other non-pharmacological pain management strategies and hope for the best. But the best oftentimes, unfortunately, was that they still suffered and their quality of life was greatly diminished. So I think it goes without saying that I do find this highly rewarding because the outcomes often are far more positive, and as I'm sure many of you have heard and experienced. All right, so this is Doterra's wellness lifestyle pyramid, which I'm sure many of you maybe have seen before several times. And before we jump into oils that support and bring balance to the inflammatory response, I do want to touch briefly on the foundation of this pyramid, which is nutrition, eating right. And there's a reason for that. I mean, as you recall with the Homer Simpson slide, many of our challenges in this area of inflammation really stem from our dietary choices, in my opinion. So we'll take just a minute to look at some better food choices. And these are just a few foods in particular that you'll want to increase in your diet, really to help balance and support that healthy inflammatory response. So you've got your fruits and leafy greens, fatty fish, nuts, olive oil is great, tomatoes. If you want a more comprehensive list of superfoods, you can check out either one or both of these websites. They both give a lot of information on what's called an anti-inflammatory diet. Dr. Axe is a naturopath, chiropractor, and clinical nutritionist. And Dr. Perricone he's actually a dermatologist, but he's written a lot of books on the relationship between healthy aging and our diets. So while we can eat clean and healthy at every meal, you know, at the end of the day, we still end up being deficient in the nutrients that our cells really need and require to function at an optimal level. And I just can't say enough good things about the Lifelong Vitality Pack. I mean, I can't go through this these slides without putting a plug in for these because they're really the foundation of our health and in conjunction with our diet. And I like to use the analogy of running a marathon. You know, if you expect to run the marathon well and even complete it, you need to have a good foundation, namely proper running shoes, right? With proper support. So you're not going to show up in your flip-flops or your wedges and expect to get very far. Likewise, I believe you need to run this marathon we call life with the Lifelong Vitality Pack as your running shoes. It's a good foundational support as we are running the race that is set before us. And you can see here the ways in which the daily nutrient pack really just helps to support our bodies. And you see that the inflammatory response in the immune system is one of them. And actually, when you think about it, all of these areas, like your digestive function, your lung function, the eye health, cardiovascular health, all those things are intertwined. So they all, relate to one another and are benefited by a strong immune system. All right, what I want you to notice here is that the antioxidants in the Lifelong Vitality Pack, specifically the alpha-flavonoids, are to inhibit that protein we discussed earlier, the NF-κB. So there you have it. These are your NF-κB inhibitors. Remember, we said before that if you can inhibit that pathway, you can reduce inflammation. And so these are the antioxidants that help do just that. And the astaxanthin, alpha-lipoic acid, the flavonoids, folic acid, glutathione, curcumin, lutein, quercetin, ginkgo biloba, and your vitamins C, B6, and E. And I will tell you just my own experience with these. I have chronic back pain from a back injury over 30 years ago. And so I've lived with back pain most of my life, and I've had to be very careful in how, with posture and lifting and things like that. And there have been times when my back's gone out and I'm down for 2 or 3 days. It has always been medically managed. Thank goodness I've never had to have surgery. But I will tell you, since I've been on the Lifelong Vitality Pack, I really don't notice the pain very much at all anymore. Not like I used to at home, especially at night. It's just not there, and it was almost like, oh wow, I'm not really feeling that pain anymore, and I know it's because of the Lifelong Vitality Pack. And my knees are another thing. I'll notice that if I miss a dose, or or miss 2, I forget to keep them with me, and then I'm climbing the stairs at night and wonder why my knees hurt, and that's usually why. It's because I've missed that LLV. So these are just a great way to really get started in supporting the inflammatory response. The deep blue polyphenol complex. You can see here what's included, the ingredients in there. You've got your frankincense, curcumin, ginger root, green tea leaf, pomegranate fruit, grape seed extract, resveratrol. All of these things are wonderful at supporting the inflammatory response, healthy cell proliferation, just promoting that good cellular health. And of course, you've got your digestive support with peppermint leaf and ginger and caraway. The key word in this complex is polyphenol. Now, I didn't, understand really what polyphenols were, and it was Dr. David Stoyer, again, who kind of cleared this up for me. I took some rough notes at that educational summit, and what he said was that polyphenols are plant metabolites with antioxidant properties. Okay, so these are the plant metabolites that you see listed. They have antioxidant properties. And antioxidants, we think of them as a thing, but they're really a behavior. And the short story is that they actually neutralize free radicals. And by doing so, they have then the ability to slow and protect against cell damage while also reducing the symptoms of pain and inflammation. So these you would take 2 capsules with food per day, 1 with your morning meal and 1 in the evening to help with pain issues. All right, so I'll briefly discuss the chemical constituents of some of the oils that have been studied to have a profound effect on supporting our inflammatory response and helping to balance that. The first are the sesquiterpenes or sesquiterpenes. I can't remember how to say that. Sesquiterpenes, I believe. So there's 6 oils that are really high in this chemical constituent. And some have analgesic properties, others are highly antispasmodic. And the one great thing about these compounds is that they cross the blood-brain barrier. We have essential oil resource books that have a lot of good information about these constituents if you want to learn more about that and how those work. So you can see here we have the cedarwood at 98%, myrrh at 62, patchouli 71, black pepper at 74, sandalwood is 90, and vetiver is 97. Okay, so I'm going to go through these pretty quickly. Again, this would be a good time to maybe take a screenshot if you can. When I list the systems that the oils support, it's in direct relationship to the inflammatory response within that system. So our cedarwood is great in supporting the inflammatory response related to our skin, our respiratory system, oral health, the nervous system, and the cardiovascular system. Myrrh, 62%, supports our skin and mucous membranes, thyroid health, immune system, digestive system, cellular support, and the respiratory system. Patchouli at 71% also has alpha-pinene in it and caryophyllene, which we'll get to those in a minute, but those are also have wonderful anti-inflammatory properties. Patchouli is great for skin and any of your, especially your acute skin reactions, similar to what lavender would do. Black pepper has that B-caryophyllene in it, and that component is really effective with spasms, especially phrenic nerve spasms, and those are what you and I know as hiccups. So black pepper is great for the musculoskeletal system, digestive, respiratory, circulatory, and nervous system. Sandalwood, one of my favorites, supports the inflammatory response related to the neurological system. Remember, these oils cross the blood-brain barrier. Cellular health, muscle tension, muscle spasms, the skin, and the stress response. So remember when we talked about that fight or flight, chronic stress, all those hormones that are released, sandalwood would be a good one for those types of support. Vetiver is another one. Mental and emotional health is very calming, 97% in the sesquiterpenes, and also great for the skin. You know, vetiver is known as the oil of tranquility. It's your clove and your cinnamon. Again, that B-caryophyllene is in there for the spasms. These are great for muscle spasms. You want to be sure to dilute these. These oils are hot and can be caustic to the skin. Cinnamon is also great for the musculoskeletal system. And then clove is a wonderful support for our cardiovascular system and also our glands. Okay, and ginger supports the inflammatory response related to the nervous system, musculoskeletal system, respiratory, and digestive system. Peppermint, we know, supports the inflammatory response related to muscle fatigue, head tension, excuse me, the respiratory system, and the digestive system. Okay, and then we have alpha-pinene. This is a class of monoterpenes, and it's a major constituent in our in pine resin or pine oil. And the alpha-pinene has been shown to inhibit or block the NF-κB pathway from going to the nucleus of the cell. And the two oils that are highest in this alpha-pinene are your frankincense and your juniper berry. So of course we have our frankincense. We often tout its anti-inflammatory properties. And that's because of the alpha-pinene, the high level of alpha-pinene in there, and the sesquiterpenes. As a matter of fact, there are studies where the Boswellia freriana was injected into joint cartilage, and it was shown to inhibit the production of pro-inflammatory mediators and another group of enzymes known as MMPs. Those are enzymes that together will break down cellular structures. And so that frankincense, when injected into the joint, was shown to inhibit the production of those. So it's wonderful for joint support, and then glandular, endocrine, neurological, respiratory, cellular, and skin. When in doubt, get the frankincense out. Juniper berry is another one. Helps support the inflammatory response related to skin, the endocrine system, specifically the pancreas and the liver. Also mental and emotional health, so again for high stress. And it's also great for spasms. And cypress, high in that alpha-pinene, supports the inflammatory response related to the vascular system, respiratory system, structural support with the musculoskeletal system, also the lymphatic system, and female organs. And this oil is not recommended for internal use. Marjoram, another one of my favorites. This one's good for the pain and swelling that's often associated with the inflammatory response. It's great for muscular tension, spasms, skin support, also head tension, and also the stress response. It's very calming. Lavender supports the inflammatory response we know related to the skin. Also that histamine response when you think of, bug bites or bee stings. The musculoskeletal system and head tension as well. The stress response, it's also very calming, and muscle spasms. Bergamot supports the inflammatory response, specifically ligaments, nerves, muscles, and head tension. Eucalyptus, great for tired, tense muscles. Also great for the respiratory system and that healthy pain response. White fir supports the inflammatory response related to sinuses and your respiratory system. Also the musculoskeletal system, specifically your structural support, as well as the circulatory system. Douglas fir is another one. We're getting a lot of pine oils. Remember that pine resin and pine oil that's in the alpha-pinene. So you get a lot of good anti-inflammatory support here with the musculoskeletal system and the respiratory system. Of course, wintergreen, 98% methyl salicylate. It's largely anti-inflammatory constituent. So anything structural, bones, joints, muscles, ligaments, tendons, a lot of support there, as well as the nervous system, skin, and urinary system. And our lemongrass. Great for your everyday aches and pains. Again, structural support, joints, ligaments, tendons. I love using lemongrass layered with frankincense and then topped with deep blue rub for joint discomfort. Also thyroid support, bladder and kidney, and the cardiovascular system when we talk about supporting healthy blood pressure and cholesterol. And of course, one of our favorites, deep blue. You can see here it's comprised of wintergreen, again, high in that methyl salicylate, camphor, high in alpha-pinene, peppermint, blue tansy, blue chamomile, and helichrysum. Right, so we'll end with just a few recipes and tips for use. This can be either a 10 ml roller bottle topped off with carrier oil, or it can be an Epsom salt mix for like for a bath. It's 4 drops juniper berry, 3 drops marjoram, 3 drops Roman chamomile, 3 drops ginger, and 3 drops of helichrysum. And you can mix those again in your roller bottle and apply on location, or put it in half a cup of salts and use that in a hot bath. More joint support. This is one that a friend of mine recommended. She needs significant support in this area with joints, and she uses 15 drops of peppermint, 15 drops of rosemary, and 10 drops of white fir, and she gets really good relief with that. Again, 10 ml roller ball, top with your carrier oil, and apply to the affected area as needed. And then for muscular support, this is an Epsom salt mix, 4 drops of black pepper, 2 drops of rosemary, 1 drop of ginger. And add that to your bath, soak for up to 30 minutes. Just remember, if you're doing an Epsom salt soak, that you are drinking plenty of water, because these oils and the salts are going to pull those toxins from your system, and you need to flush them out. And so you're going to have to be really hydrated to do that. Okay, so here's just a couple of tips. Now, when we're applying the oils topically, they're highly effective in most situations, especially for structural support. And you're going to apply them directly to the area of concern. Always use carrier oil. I recommend using carrier oil for a lot of reasons, but specifically, you can. It's a good idea to use it to avoid any potential sensitivity. And you can apply these every 20 to 30 minutes until therapeutic benefit is achieved, and then every 2 to 6 hours is needed for that short-term support. And then for long-term support, you can apply 2 to 3 times daily. Another option is layering the oils. That is also very effective. And then internal use, highly effective for long-term support and or internal organ or system support. So when we're talking about systemic issues that we're trying to address, ongoing chronic conditions, internal use is highly effective. So you can do that by placing the oils in a capsule. Again, I like to add a little bit of carrier oil to those as well. The other option then is to drop them directly under the tongue, hold for 30 seconds, and then swallow. And just be sure you're, using oils that are recommended for internal use. And that's it. My last piece of advice is to keep calm and apply essential oils.
Awesome. Thank you so much, Diane. I'm going to stop the recording quickly, and then just for a few minutes, those who are live, if you have questions, feel free to go ahead and type those into the chat box or on Facebook Live. and we'll see if we have time to take just a few questions. Just a moment here.